The final PowerPoint lecture is going to be about perceptual development, and you will notice that I am including some information that is not in the book, as well as I'm including information from the book, but these are, he has changed this around so that this is now at the very end of each chapter. If there was something relevant for him to talk about with perceptual development, that's where he does this. So it's a little bit tricky to find, but it's most of it is there, and then everything I put into the review is definitely in these slides. He starts out the first section of perceptual development talking about how early events are powerful, and we can think of this in two different ways. Early events in our lives are powerful. We've already seen that those kittens who are reared without, let's say, horizontal stripes or horizontal bars in their visual world, they do not create the neurons to perceive those horizontal bars, and they end up not seeing those horizontal bars. But we also, what he's really talking about here is specifically the early events in the visual system. So what's happening at the level of the cornea and the lens and the photoreceptors are going to largely influence our perceptual world. We don't have it. We need to get the information to the cortex, and no matter how much the cortex kind of sharpens things for us, if the lens and cornea are giving us, or the shape of our eye are giving us a blurry world, we're going to end out with a blurry world. If we don't have cones, we're going to end out with rod vision and no high acuity, no ability for color vision. And if we end out losing our rods, we're going to just be dealing with cones, and we're going to have that kind of tunnel vision that's mostly just the fovea and a little bit of peripheral vision in the daylight, and no nighttime vision, because those early events in the system are powerful. And he shows this by giving us one of the early pictures from the Hubble telescope. Okay, if you have been in another class with me, you might notice that I have this secret interest in astrophysics, and I end up going sometimes to the astrophysics lectures that are over in the Darla Moore building. They are always absolutely fascinating. So I had to include this. You might also notice that I really am interested in how different animals perceive the world, and I feel like we get this little teeny tiny sliver of everything, auditory world, visual world, everything, and we get that in a specific context of our lives, which are necessarily in a particular time in history, in a particular place, and tied to us and our lifespans. And that's it. These are the years that we have, and this is the material and perception that we are allowed. Okay, so if I go in, so not only you might have gotten from this, maybe not, as I am a little bit babbling. One of the things I am also really interested in is life on other planets, and what life on other planets might be experiencing differently than we do. But anyway, so here's the first picture from the Hubble telescope where they sent up the cameras, and you can see, compared to the second one, you can tell that it's blurry, and they could tell that it was blurry, that the lens, there was just something wrong with the lens, and then they sent up corrective lens, basically glasses for the Hubble telescope, and you can see in B there how much better and how much more crisp and clear that world is. And so no matter what was kind of on the receiving end, no matter what the computers were or the calculations or what we had in order to understand what was going on in space, that first picture was just blurry. And without fixing the camera, the very early pieces of that experience, it was not possible to change that blurriness. And I have my basic color vision slide or visual slide that tells us about the electromagnetic spectrum and what part of the spectrum we're seeing, just to remind you again, it's a sliver. We get that sliver, and different animals have different slivers. And here he has a picture in the book of, it's a black and white picture, but if you go out and look at what honeybees are seeing, or sometimes it's different birds, they've gone out with tetrachromatic lenses and done their best to show us what they're seeing. And I'm going to use honeybees because it's kind of easiest, but if we look at a flower, and I remember this really yellow flower that is all yellow and very, very pretty, and it's this kind of bright yellow with this little pistons hanging off of there. What the honeybee sees is basically a few colors, and in the middle is it's almost like a bullseye saying, here's the pollen, here is your food, this is where you want to go. And we don't need that bullseye because our food is not in the center of that flower, and so they're getting a different world than us that evolutionarily makes sense for the survival of honeybees. One question that arises with perceptual development is how infants and toddlers and young children really communicate to us what they are able to perceive. And so we're going to look at infant visual acuity as an example of how they can communicate to us. Usually what we use is a preferential looking technique. I'm going to talk about a couple of different techniques here, maybe 3 or 4 techniques, but the main one that really changed the field of development was this preferential looking technique, where if what an infant is perceiving out in the world are those 2 circles that the infant's looking at, if those appeared to be the same to the infant, there would be no preferential looking. The infant would look back and forth between the gray and the gratings with the black and white gratings. They would look back and forth about equally. And you can see this little dot in between those 2 stimuli. And that dot is actually where the experimenter, so that's the mom holding her infant, and on the other side of that, the experimenter is taking calculations of how long the infant is looking at each of these stimuli, because that way the experimenter is staying blind to what the infant is looking at, and we get rid of the kind of bias that we might see. And so in this case, well, one thing we know is that from infants and what they tell us is that they prefer objects with contours and patterns to objects that are just homogeneous and are the same all the way across. And so in this case, the infant is going to have a longer looking time at that grading bar than at the gray circle. And then we're going to be able to say, basically what the infant is saying with that is, yes, I can see the gratings. And if you remember, very early on, we looked at grading acuity and how we could make those gratings with less contrast, so more gray and white, and then lighter and lighter gray, or we could make those gratings narrower and narrower, and there's a point when we cannot see them anymore. And we can do the same thing with the infant. There's a point when the infant starts to look, so if we get those gratings narrower and narrower, there's a place where the infant starts to look back and forth about the same and doesn't have a preference for the gratings. And that's how we test. That's one way of testing visual acuity in infants. And what we see is they're born with pretty poor acuity. This really increases clearly between 6 to 9 months. And then it kind of plateaus off where it's not increasing as quickly. And then it starts to look like adult acuity. And that's really about after a year old, they start to look like they have the same visual acuity or similar visual acuity as adults. The author also shows here that we now sometimes take visual evoked potential. So looking at an ERP or the EEG in response to these kinds of gray circles or grading bars, and the visual evoked potential shows a similar pattern. It looks like infants have a little bit more acuity than we were giving them credit for with the preferential looking technique, but that pattern of how they're getting better through 6 to 9 months and how that plateaus until we get to about 12 months, maybe 13 months, where they start to look a lot like an adult and completely plateaus, that appears to be the same. I'm going to move through the neonatal senses and talk just a bit about each one of our 5 senses, but starting with the most developed sense, which is touch, and then ending with the least developed sense, which is vision. And so with touch, this appears to be the most developed sense as upon leaving the womb. If you've talked to people in the neonatal units or NICUs, so the neonatal intensive care units, what neonates appear to prefer or be happiest, where we can measure their heartbeat and everything to see that they are the most comfortable and happy, is to be pressed up against their mother and feeling her heartbeat, which would be the same thing they were feeling in the womb. as early as 2 months gestation, so 2 months after conception, we see that the rooting reflex is present. And I'm going to start talking about the reflexes in a minute, but the rooting reflex is basically if we touch the side of an infant's face, or a 2-month fetus, we touch the side of the face, they will move their head that way, and they will move their face towards that, and then especially after they'll start the sucking as well, where that is allowing them to feel the breast, find the breast, and suck on the breast. But this rooting reflex is present at 2 months gestation. By 7 months gestation, all body parts respond to touch. And when the neonates are born, we are testing their nervous system by testing their reflexes, and those reflexes are all dependent on touch. Their reflexes are responding to touch. Neonates do feel pain. I have an exclamation point. You might say, of course they feel pain, but for a long time, scientists thought and doctors thought that they did not feel pain because what they often do is cry for a very short time and stop, or cry for a very short time and basically fall asleep. And so it wasn't clear that they were feeling pain, although we have a pain cry, and it has become more and more clear to us that yes, they do feel pain. And one of the things that we can do to alleviate their pain to some extent is to give them something sweet to suck on. But they used to just think they could do whatever they wanted to neonates and they didn't feel anything, but that is not true. Here's my picture of some neonatal reflexes, and if you notice, I'm only really asking you in the review to notice the rooting and the sucking reflexes. Really, they're the ones that are most obvious and are really necessary for the infants to survive. These other reflexes are reflexes that we are born with that appear to be evolutionarily, they appear to make sense, and then they also disappear very quickly as we are inhibiting these reflexes. So one is the step reflex. If we hold up a baby under their arms and let their feet just touch the floor, they will make stepping motions. This appears to disappear around 2 months. They have similarly a kind of swimming reflex that if we put them in water, they will appear to be swimming. And this also disappears, where later on we have to learn, right, how to voluntarily step and how to voluntarily swim. But at first, these are reflexes. We have the Moreau reflex, which is very cute if you ever get a chance to see an infant do this, where if we kind of dip them down suddenly, or if there's a loud noise, but really I think of it as you're putting your hands on the back of the infant and you just kind of let your hand down a little bit so that they dip down. They will arch their back, extend their arms and legs outward, and then bring their arms together swiftly. And normally I do this with a lot of moving around and showing you, but if you can imagine evolutionarily, this makes sense for our primate ancestors, that if they lose the support on their back, that if they extend their arms and legs outwards and then bring in their arms swiftly, they are basically grasping at their mom. And so this is a reflex that makes sense evolutionarily. And that too, it disappears around 3 months. The Babkin reflex, where we press and stroke both palms, the mouth opens, eyes close, and the head tilts forward. That wasn't the one I was thinking of, because I have these other ones on there. One is the grasping reflex, which is, so if you're moving to now the pictures, and if you also have seen me in other classes, you know that I love these pictures, and the more pictures of babies that I can show, the happier I really kind of am. But so this grasping reflex is pretty cute. We put our hand or our finger or something on their hand, on the palm of their hand, and they will grasp. And the Babinski reflex, if we stroke the bottom of the infant's foot, their toes will fan out, so their small toes will go in one direction and their big toe will go up in the other direction. I usually say for these two in a lot of my classes, because I'm also talking about alcohol and drugs and so forth. So these are reflexes that, again, we're born with and that disappear over time. We're basically inhibiting these as when we're very young. But if you want to see how drunk your friend is, these reflexes will come back if we are drunk enough to stop that inhibition. And that person is way past not being able to drive. That person is probably really, really damaging their brain. But if you touch their hand, their palm, they'll grab it, and your friends aren't going to want you to brush the bottom of their foot. But normally, if you touch the bottom of an adult's foot, right, we kind of crinkle in. It's ticklish, and we crinkle in our foot. So if they're doing this Babinski reflex, they are horribly, horribly drunk and need to be probably taken care of for the rest of the night. The bottom one there is the rooting reflex, which is the touch on the cheek or on the mouth. They will turn towards the touch, and that really starts the sucking reflex because something touched them on the cheek. That object is still there, and so they're going to hit it with their mouth, and now they're going to start sucking. And again, those are, for us, those really keep us so that we can find our mother's breast and breastfeed very naturally. And that starts to disappear at 4 months, or really has disappeared by 4 months. The senses of taste and smell are also well developed even in the womb. The fetus is floating in amniotic fluid, which is going to have the flavor of whatever the mother has recently eaten. The infant prefers the smell of their mother's amniotic fluid over another woman's amniotic fluid, and even by 4 days old, they orient toward their mother's smell over the smell of other people. We can also see that infants prefer sweet tastes, as they will smile and suck, and we can use sweet tastes to help when they are in pain. It helps to alleviate that pain a bit. They prefer sweet tastes and smells over bitter or sour tastes or smells. So usually we see a kind of crinkling of the nose and a wrinkling of the forehead to those bitter and sour tastes and smells. In a study conducted by Julie Manella and her colleagues in 2001, they had either the mother drank carrot juice in that final trimester while she was still pregnant, and then during the first 2 months of lactation, so during breastfeeding, she was drinking water. Or in another group, they had a different group of women drinking water during that last trimester, and then drinking carrot juice during that first 2 months of lactation during breastfeeding. Or they had, and the third group had women drinking water during both the last trimester and during breastfeeding. And what they found was that infants who experienced carrot juice would later, if they had the choice of a carrot flavored cereal or a plain flavored or plain cereal, those infants would choose the carrot flavored cereal. Okay, and that was whether that was at 4 months old, and that was whether the woman drank carrot juice during the last trimester, or if the woman drank carrot juice during those first 2 months of lactation, of breastfeeding. And so clearly it was during all of that time that infants were able to taste the carrot juice. I'll say taste and smell since it goes up through that retronasal root, the nasal pharynx, and so it's the flavor. If we look at infant hearing, infants are born being able to hear. They actually have some fluid in their ears for a little while, and so it's really muffled. And they continue to have some development of this system as that eustachian tube is developing as well. So your author is showing here, so this is a kind of a complicated way of figuring out what they're hearing. Some of the times what they do is this sucking time response where they're listening to something and they're sucking on a pacifier, and they'll suck harder in order to, if we make them suck harder in order to hear something, they'll suck harder in order to hear something. And so sometimes they'll tie a light with a sound, and then the infant will suck, and the longer they suck hard in order to hear the sound, the more they prefer that sound. So it's kind of like preferential looking, but they have some other ways of seeing whether or not infants can hear. I just wanted to put the picture of the cute little infant up there, but another way, and you can see the headphones on. Another way they do this is just by having a blind researcher, so a researcher experimenter who is watching the child or the infant but does not know what the infant is actually hearing. They are basically in the left hand in A, they're giving the percentage of yes responses where the infant appears to be hearing some particular sound. And you can see, though, that they have a curve of even if there's no sound, so we're going from no sound to 10 decibels to 20 decibels and so forth. Even if there's no sound, sometimes they're having some reaction that the researcher is saying, it looks like they might be hearing a sound. So they're taking that curve into account for various frequencies at different decibel levels. And I'm not going to go into the calculation of that. You just have to realize they're taking into account the fact that there are these false positives in infants. And so if we do that and we look at the threshold for infants, so where as we go lower, we're getting more sensitive. At 3 months old, they're really not as sensitive as adults. At 6 months old, we can see that they're developing in their sensitivity, and that really is about at that level until almost about a year old. And again, there's still some development of the eustachian tube for a little while that slows the development of audibility thresholds of being able to hear well, but they can hear a range of sounds, and you can see that their audibility curve is similar, or it has a similar pattern as adults, and especially as we move into about 6 months old. As they're in the 3 months old, you can see that they're even worse at the high frequency sounds than adults are in the pattern of the whole thing. DeCasper and Pfeiffer in 1980 found that 2-day-old infants can recognize their mother's voice. So this is one of the ones where they did a kind of a preferential sucking technique, if you will. So they're sucking hard. They will suck harder to hear their mother's voice than voices of other women. Some generalities of neonatal senses of the neonatal sense of hearing. As I said, they prefer their mother's voice over other women's voices. They prefer their mother's language to foreign languages. There is a study called the Cat in the Hat study by DeCasper and Spence in 1986, where over those last 6 weeks that the woman was pregnant, she read The Cat in the Hat. And they've done this with other books at this point. And then after the child is born, then the neonate prefers to hear The Cat in the Hat than other books. So it's clear that they're getting they're hearing something from inside the mother, even before they are born, and at least the prosody and rhythm of that book they're at least hearing that much. When they're days old, they can tell ba from ga, and they can tell when a 2-syllable word changes to a 3-syllable word. They can also tell changes in accent and emphasis. So if we say mama versus mama, they can tell those changes. And all of these, again, they're using a sucking measure as a measure of preference. And at this point, I don't think I've said this yet, or we've used this yet. They're often using a habituation measure. So if I am getting them to suck to hear the word ba, 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 and then it changes and they start to habituate, and they're not sucking as hard, or sometimes they're not looking as long at something, and then we change that. In this case, since it's hearing, we're going to use sucking, and we change that from ba to ga, and they start sucking again. That tells us that yes, they can perceive that difference. And at only a few days old, they respond when a series of musical notes changes from ascending to descending order. If we look at learning the sounds of language, and they did this using a habituation procedure of that kind of sucking response, and we are asking 6 to 8 month olds, whether they're American or Japanese infants, okay? And we're having them respond to the change between the L, R, L, R difference, so la to ra, la to ra. And as they habituate to la, 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 and then we change to ra, and so we've habituated to la, and when we change to ra, then they're going to start sucking again to hear that new sound because they can perceive it. We can see that at 6 to 8 months old, American infants look just like Japanese infants in their being able to hear that and to want that change. By the time we're 10 to 12 months old, and in fact, if I remember correctly, the study like Cool 2000 was on 11-month-olds, that at that point, the American infants have an even stronger preference or stronger ability to hear the difference between la and ra as they've habituated to la and they start sucking to ra. And Japanese infants, we see less of a change as they're not able to perceive the la to ra difference. And if you have met people from Japan, or you know that kind of that inability that they have for not hearing the difference between L and R. I've actually had a very good friend in graduate school who would just ask you straight out, is that an L or an R? So that she could practice saying it right. But they don't have that phonemic difference in their language, and so they stop being able to hear that difference in their language. Patricia Cool is quoted as saying of very young infants that they are, quote, citizens of the world, as we are able to hear any possible phonemic difference when we are born, and it's through experience that we learn to hear the differences in our language, and we stop being able to hear the differences in other languages that we haven't been hearing or learning. So this is a really great example of experience-dependent plasticity, a change in the brain's ability to respond to specific stimuli that occurs because of experience. And this is going to be repetition, and these are the last 2 slides, so if you want to go ahead and cut this off, that's fine, but I'm going to do this whole be amazed like I did in the review. It's amazing. This is the Safran et al. Looking at 8-month-old infants and their ability to learn from transitional probabilities. So this is the study. I went over this in speech perception because it's one of my favorite studies, where I really like nonsense words and so forth. So they went through Bidaku, Padoti, Golabu, Tupiro as their 4 new words, and then they put those together randomly so that statistically, if I'm hearing Bidaku, and you can see that the syllables are all different for each of the words, there's no repeating syllable in any 2 words. Bidaku, da is going to follow B 100% of the time, ku is going to follow da 100% of the time, and that's my word Bidaku. Pa is going to follow ku at the end of Bidaku 33% of the time. Go is going to follow ku at the end of Bidaku 33% of the time, and tu from Tupiro is going to follow ku from Bidaku 33% of the time. So those are the statistics that are involved in what we're hearing. And the question is, right, for Safran et al., is are we picking up on these transitional probabilities? And certainly at 8 months old, the answer is yes, right? And in fact, just listening to those non-words for 2 minutes allowed infants to be able to tell those whole words, Bidaku, Padoti, from partial words. If they mix those words together with the different syllables, those sounded like new, novel words to the infants, and they were more interested in that. And so if we look at their listening time, they listen longer to the partial words as to the whole words as they've learned those transitional probabilities, again, in just 2 minutes. So these abilities of ours are pretty incredible of what we are able to perceive and the amount of information that gives us when we are infants.